Hi nurses, this is Dr. Casey Scudmore again, and this time we're going to be doing an IV pump tutorial. This is our Alaris pump, and it has a brain and channels that you can attach. The channel is what you put the IV tubing in that I'll be showing you in a minute. The channels can come off by pushing this little button and lifting. I'm making it look easy. Sometimes it takes a few minutes to get. And then there's a little slot here that goes inside, and you have to line it up and make sure it snaps. Okay, you can put 4 channels on one brain. Most of us put 2 channels on each side if we need to add another IV tubing, but if you need to rearrange things because of how your room is set up or some equipment you have, you could put 2 or 3 on one side, but only 4. The brain, like it sounds, is going to control the entire IV pump. Now, it is not very forgiving. So if you turn it on and then you spend some time doing things, it will start alarming at you very loudly within just a few seconds. So I recommend getting everything hooked up to your patient and ready to go, and then turning the pump on. There's an on button, and then you'll see it'll warm up. And then it usually asks you if it's a new patient or to continue with your previous patient. So here's a new patient. So if you're restarting an IV on a patient that's been in the room for a while, you're going to want to say no, it's not a new patient. Then it'll retain some of your previous settings. So we're going to go ahead and say yes, this is a new patient. And depending on what department you're in, it'll ask you, is this the ICU? Is this OB? And so you're going to say yes. And then you're going to have some dashes. You can type in the number. Usually it's like the patient's medical record number. That may vary based on what unit you're on. So ask your clinical instructor, and then you'll put in the patient's identification and confirm. Okay. We want it to be touchscreen because of our smartphones, but you have to push the buttons on the side or the bottom that correlate with the menu item that you want. So now this is just on and ready for you to go. Now channel select will get you everywhere you want to go. So that's all that we need for the brain. Now everything is going to be on the channel. Okay. So what you'll do is, and we'll do this in a minute, you'll put in your IV tubing and you'll do channel select, and then pretty much the pump will guide you. I want to show you some of the supplies for the IV pump. So this is a primary bag, a liter bag of fluid, and it comes in all different types: dextrose, normal saline, lactated ringers that you'll learn about in your IV module. Usually they come in a bag. When you're practicing in the lab, they won't be in a bag, so I like to show you what they'll look like in the hospital. There's usually a notch for easy opening. You're going to check the expiration date. You're going to check that the bag is clear, there isn't any kind of sediment or something floating around or cloudy, that type of thing. There's going to be 2 ports at the bottom. The blue with the pull, sometimes it's a clear with a pull, is the one that you're going to use to spike your IV fluids. Now if I just pull this off now, it's not going to leak because we haven't spiked it. We haven't put a hole in it yet. That's something that students worry about. This is the IV tubing, and it also comes in a bag. Again, when you're in the lab practicing, there will be no bags because they've already been used. But in the hospital, you'll see it comes in a bag. There's a picture of the tubing if you're not sure if you're getting the correct tubing. The blood, I don't have an example, but the blood tubing has red writing on the package. So just be cautious that you're getting the correct tubing. If you turn it over, you'll see that we have it, the tubing is curled up, we have a spike, and then we have this blue plastic piece. That tells you that you're getting pump tubing. So if you're trying to get tubing that you're going to attach to a pump and then attach to a patient, make sure it has this blue. Otherwise, you're getting some other kind of random OR tubing or something that's not going to work in the pump. There is a tear to open with perforation. You're going to pull your tubing out. All tubing comes unclamped. So the first thing that you want to do with your tubing is find the roller clamp and roll it down to the skinny part. And you'll feel it gets kind of harder to roll. That tells you that you're closing it. There are multiple ways to clamp your tubing, but that's probably the best, easiest way to control your tubing. It's always wrapped up with these little tapes, and you don't necessarily have to pull those off until you're ready to hook it into the pump. That's personal choice. We have a spike here, and we have an air vent. The air vent only needs to be open if you're hanging something in a glass bottle. So for the most part, this stays closed. Then what you're going to do is take off the protective covering from your spike. Don't touch this. We don't want to contaminate it because then we're going to put germs inside of our IV bag. And then you're going to get a good hold on your IV bag, and then you're going to insert the spike. There's a little line here on the spike that shows you how far to push into the bag. And sometimes this takes a lot of muscle. So you're going to want to do some forearm workouts. As you can see, I'm not doing a very good job here. All right, so then you're going to hang your bag. And then we're going to squeeze. This is the drip chamber. This is where when your bag is actually infusing, you will see drips. Now we need to prime it because right now this is full of air and that's not good for our patient, and it doesn't make the pump happy. The pump will alarm whenever it detects air so that the patient does not get any air bolus. So now I'm going to undo the tubing. Now if I had a sink nearby, I would be using the sink to prime my tubing. In the lab, we often are using the trash can because the trash can is clean. The problem with that is then in the hospital, you're wanting to prime into the trash can, which is dirty. So I often use the bag, and I'm just going to put the tubing inside the bag because the bag is clean. And then I'm going to control how much flow I get with the roller clamp. So you can see now my fluid is dripping in the chamber and my bubbles are going away, and pretty soon you'll see the fluid dripping inside the bag. Okay. So once I get rid of all of my air bubbles, I'm going to reclose my clamp. As you've noticed, I've left the cap on my tubing to keep that clean. There's no need to remove that when you're priming your tubing. Then I need to take this blue plastic piece, because this is the piece that is going inside my pump. So I'm going to take that. That goes in the trash. Now I have this little piece that's going to be going inside of my IV pump. To open the channel, there's a lever here, and I'm going to just lift this lever. Notice I haven't turned anything on or made it alarm. You're going to drop from the top. This piece goes in the top here, and it needs to be flush with this first little lip. This piece is going to slide in at the bottom and push in. Now the pump knows I have tubing in here, so now it's getting upset and it's alarming. There's also a little notch here that your tubing must go in, otherwise you won't be able to close your door. This seems to be a two-handed process because for whatever reason it doesn't want to latch unless you're supporting the top. So I recommend holding the top and pushing the bottom down. Some of them are a little more difficult because they've had a lot of use. Okay, so now I'm ready. This I will connect to the patient. I will flush the saline lock with saline, and I will take my cap off, and I will screw this into my Y tubing. The next thing I'm going to do, I need to tell the channel and the brain how fast do I want my fluid. Now, the nice thing about the Alaris pump is it's a smart pump in that it has a menu of drugs so that it guides us in how fast to hang things. It also will show a lighted name across the pump so that you can easily see what is infusing. So that's what these smart pumps are for. They also have a Wi-Fi card in them, so when pharmacy makes changes or updates, they can just send out a signal and it tells all the pumps the new information. So as nurses, we have a fairly current library of medication. So what we're going to do, you can see this is channel A, and as you add channels, the pump labels them. And you'll see now that I've plugged another channel in, this will then change to channel B. It doesn't matter what channel you're using, but it just will show you here what label, what IV is infusing in each channel. So I'm here, I want to do channel select. That's always the first button that you're going to push. It gives me a menu here. I can pick drugs, fluids, or basic. Basic is what you use when your drug is not in the menu. So here I'm going to do fluids, and you can see there's a whole list of fluids. I can page down if I want to see what's in the menu. So you guys should play with this and see kind of what your options are. So for right now, I'm just going to pick 0.9% normal saline just to demonstrate for you. And then it's going to ask me, hey, is this correct? I'm going to double check my bag and I'm going to say, oh, no, this is 5% dextrose. So I'm going to say no. And I'm going to go down and see if I have dextrose in here. Okay, so there's my D5W. That would be 5% dextrose. Okay, so I'm going to choose that. And it asks me, is this correct? I'm going to say yes. Now it says, okay, well, how fast do you want it? That would be the rate. VTBI is volume to be infused. How many mLs are you going to infuse before you want me to alarm? So I'm going to push, see, it's already alarming at me. You push rate. So this is where I go to my order and I say, oh, how fast does the doctor want it? So he wants it at 100 mLs an hour. So I type in 100. And notice I have to push to highlight the box that I'm working with. So now I want volume to be infused. There's 1,000 mLs in the bag, and I would like it to alert me so that I know I have time to go get another bag. So we usually set it for something like 900, maybe 800. There's no hard and fast rule how you have to set that. And then at the bottom, there's a button here that says start. And now it will infuse. I'm going to put this in my bottle here. When we're in the lab, you can put the end of your tubing in the bottle so that we don't get the floor all wet. Now you can see there's a yellow light and it says checking line. Probably because the pump can't infuse because something is clamped. This is the #1 thing that we do wrong. So I'm going to unclamp. Now it's red, it's flashing at me, and this is nice because from outside the room you can look in and see that your pump is alarming. Now I'm going to hit restart. Now it's green. Green means go, we're happy with green. So you can glance in your room at any time and see, oh, my IVs, the pump is happy. You still need to look at your patient. I mean, the IV could be going into the bed, but the pump is happy. So you just, if you hear a pump alarming from the hallway, you can glance in and see which pump it is that's alarming. Okay? So that is how you hang a primary IV. Now we're going to hang a piggyback or a secondary. This is like an antibiotic usually that you'd be hanging. It could be an electrolyte bolus of some sort, but usually a piggyback. Piggybacks come in all different kinds of sizes and packaging, and you'll get experience with that in the hospital and different ways of mixing. A lot of times the drug is in one section in a powder form, and in the other section there's fluid, and you have to mix them. You'll learn that when you're in clinic. Piggybacks come anywhere from 50 mLs, 100 mLs, 250 mLs. So here I have a 100 ml piggyback. Now it should have a drug name on it, but this is just for demonstration. So again, I'm going to look for my notch and get my package open. When you get an order for an antibiotic, for example, Ancef, 2 grams, there will not be an order for a rate. The rate is something that you have to find in your drug book, and the pump will guide us and say it recommends hanging this over 100 mLs an hour. So my rule of thumb is most piggybacks you can run over 30 minutes to an hour. That's usually your first starting point. Then you can look in your drug book and it'll tell you don't run faster than so many milligrams per minute. So here I have a 50 ml piggyback, and you can see the bottom little tabs look very similar. The pharmacy has probably injected medication in this one. So again, I'm going to choose the pull tab, and I don't leak. Now once I've spiked it, it will run all over the place. Secondary tubing comes in different packaging. If you're not sure what kind of tubing you have, this is the clue right here, this little blue piece. That tells us we have secondary tubing. This pump runs largely on gravity, so whatever is hanging higher is what will infuse. So we're going to open our package. And remember I said when you take tubing out of a package, it's unclamped. I'm going to just set this aside for a minute. So here's my tubing. You can see it's much shorter, and it doesn't have that blue piece that goes inside the pump. I'm going to clamp it, so you're going to roll it down to the skinny piece, just like the other tubing. Then I'm going to remove the cap from my spike, and again, I'm going to spike my little piggyback bag. Okay, I'm going to squeeze my chamber. Now I need to do something so that my piggyback will infuse. If I just hang it up here and it's at the same level as my primary will be the thing that the pump is pulling from. So then I'll come back after having programmed my pump, and my piggyback will be hanging there still full of medicine because I didn't hang my main bag lower. That is what this funny little piece is for. Some poles have a little separate piece that you can hang your primary bag on. So I'm going to open this up. This piece is going to go onto my pole, and then I'm going to hang this on the hook. Now my secondary is hanging higher than my primary. This is how you have to have it if you want your secondary to infuse. Then I'm going to take my secondary tubing, and yes, I know it's still full of air. We're going to fix that in a minute. I'm going to take my primary tubing. If you follow it from the chamber, you'll find there's a port here. I need to clean this with alcohol. Notice I'm not touching it now, and I'm not touching the end of my tubing so that I don't contaminate. I'm going to screw this on. Now I have to get rid of the air in my piggyback, my tubing. So I'm going to take it off of here. I'm going to unclamp it, and I'm going to lower it below my primary. And you can see my primary is running fluid into the tubing. So now I'm getting rid of all of my air. It's going into my secondary bag. Now what happens is your chamber fills up. Now I can't tell if it's dripping. So you can just turn it over, a couple of squeezes, and now I'll be able to see it dripping. I'm going to hang this back up, and now I can prime or set my pump. So that process is called back priming. So again, channel select gets me everywhere I want to go. A secondary, the way it works is it delays the primary so that my primary IV won't infuse while the secondary is infusing. So I'm going to say channel select, and you can see there's different choices here. I'm going to say secondary. And now I have a whole list of drugs, and the drug names are in generic form. So I'm just going to go with Ansef, which is what I was talking about before. The other name is cefazolin. So I'm going to choose cefazolin. It's going to give me some choices. I'm going to look at my bag, and I'm going to say, okay, my bag says it was 2 grams, 2,000 milligrams, and 50 mLs. So that's what I'm going to choose. And it's going to say, is this correct? Yes. And it's going to ask me one more time, are you sure? So it's going to give me a concentration and some different information. And I'm going to say next. Now it's asking me, well, how fast do you want to run it? Well, I've already researched this, and I know I want to run it over 30 minutes. So I'm going to touch next to duration and type in 30. And it will fill in everything else for me. And then there's a start button. It's reminding me, hey, make sure your clamp is unclamped. And I'm going to hit start. Now it's showing across here cefazolin, and it's showing me what's going. After this has infused, the secondary will stop, the primary will restart automatically without having to do anything, okay? So that's the basics of how to set a primary and secondary. Just a couple of other things. Everything has to have a label. Both hospitals have different colored labels. Palmdale has yellow, AV has pink, but whatever the case, use the hospital label for the bag. Every bag needs a label. You're going to write the date, the time. IV bags are only good for 24 hours. You're going to stick it on the bag. And I'm going to make another one for my piggyback. Then there are orange labels or white labels that you can put the tubing dates and when they expire. They're good for 72 hours. So I'm going to put that, and I'm going to tape it here. Some nurses tape it on the chamber. That's fine as long as you're not obscuring the ability to see it drip. Okay? So as long as you stick it on your tubing somewhere. A couple of other things. That's the basics. If you have a patient maybe that's going for a procedure, you want to saline lock them, or you just don't want the pump to alarm for a certain amount of time because of a procedure or something, there's a way to delay your pump. This is not an essential thing for you to know. I'm just letting you know that it's out there. You do a channel select, and then you will have a delay options. Let me get it back to my primary. Okay, so when your primary is running, channel select, delay options. If you do delay options, it gives you some choices. I often will just say delay for like 10 minutes. Maybe my patient needs to get up to the restroom and I'm going to saline lock and put a cap on their tubing, or take a shower, let them go take a shower. Now the pump, it'll stay orange and it'll tell you, hey, you're delayed for 10 minutes. I'm going to let you do whatever you want to do. I'm not going to alarm for 10 minutes. So then the patient comes back, you hook them back up, and now I'm going to do channel select, and I'm going to say start. And it says, hey, we're delayed here. You're going to say, that's okay, I'm done with the delay. I'm going to cancel the delay. And then it will restart. Okay, so that's another thing. If your patient is occluding their IV because they have an antecubital, that means that it's going to occlude in the tubing. You'll see it start to turn orange, and then it will turn red. So there's the orange because it's detecting it's not flowing. And it doesn't give you very long before it gets upset. Then it'll flash red and alarm. And it tells you right here, if you come in the room and you're like, what's wrong with my IV? Read the screen and it'll say occluded patient side. And then you just come in and hit restart and have your patient straighten their arm. Always check your patient. So that is the IV pumps and the tubing. Have fun and good luck.